Hello, everybody. So I'm going to get started. First of all, welcome and thank you for joining today. My name, for anyone who doesn't know me, is Dr. Nancy Berley. I'm the medical director here at Tembo. And today we're going to talk about how to use medications safely and why in dementia care sometimes less can actually be. And we know that many medicines are important and helpful, but as the list grows, so can the risks. Now, my goal today isn't to make you think that your loved one is on too many medications or that you should stop anything. This isn't necessarily about taking things away. It's just about understanding why medications are used, how they can sometimes interact, and when it might make sense to ask questions or check in with the doctor. Also, sometimes the doctor may suggest stopping or changing a medication. And I think sometimes for families, that can feel confusing or even worrisome, especially if it's something your loved one's been taking for a long time. But we'll talk about why those recommendations are sometimes made and what to ask and how to make sure that your loved one's care is safe, effective, and really just with the goal of improving quality of life. So, as I mentioned, I'm Dr. Nancy Berley, and I'm the medical director here at Tembo. Just a little bit more about me. I've been practicing family medicine for over 20 years. And at Tembo, I help lead our dementia care program, and I support families and the care teams, like the care navigators, as we work together to provide safe and thoughtful care for people living with cognitive impairment. And my focus is really on helping families feel informed, supported, and confident throughout the dementia journey. And I do that alongside my care navigators who do a fantastic job. And sometimes when there's clinical questions, they come my way. So let's talk a little bit about what we're going to talk about during this webinar. So first, we're going to talk about polypharmacy, just what it means, how it happens, and why it's important to pay attention to it in dementia care. We'll walk through some simple safety principles and talk about when it might make sense to take another look at medications and think about changes or reductions. And finally, we're going to discuss practical things that families can do to feel more confident when they're talking to the doctors and partnering with their care teams to really understand um, any issues that could come up around medication. So let's start with what is polypharmacy? And literally, it means many medications. And clinically, we use 5 medications for the definition of polypharmacy. And the reason is that once people are on five medications, that's when we start to see a real increase in the risk of side effects, the risk of interactions, the risk of problems related to the medications, really at that sort of 5 medication off. And I'll be honest, that number isn't very hard to hit. I think many of us, probably myself included, could probably look in our cabinets and realize we're at 5 without trying, especially if we count things like vitamins or supplements or the occasional over-the-counter medication. So 5 by itself doesn't necessarily mean something is wrong. That's just where we start to think about this definition. Um, but from what we know from research, like I said, the chances of these sort of medication-related issues are noticeable at that point. The risk gets quite a bit higher once we get to 10 or more medications. And that's usually when I start to take notice, when I'm looking at a list and it's creeping up there near 10. That just adds to the risks. So just a note about supplements. We do include those, and we include over-the-counter medications. Now, supplements may feel natural or they may seem harmless, like it's just a vitamin or it's just a supplement, but they do still act on the body and they can interact with prescription medications. For example, some herbal medications or sleep aids can increase how like sedation or how sleepy somebody is. Some can affect blood pressure, or they can change how the other medications work. So we really have to think about all of it and not just the things in the prescription bottles. And it's not because they're bad, it's just because the body has to process them. And they can make other medications stronger or weaker or harder to manage. So the goal is really to look at the whole picture of what someone is taking and just pause and make sure each medication still has a purpose and still has a benefit that outweighs any risks. So let's talk a little bit about how this happens because it's actually pretty easy to get there. So often we'll see that people tend to have more than one medical problem, especially as we age, we develop more medical problems. So imagine someone has high cholesterol and they're on medication for that. And then their blood pressure becomes an issue, and maybe the doctor puts them on one or even two blood pressure medications. Maybe they have some heartburn and they start to take some over the counter Pepsid. And then maybe sleep becomes harder and they take some melatonin. And again, we've got one over the counter, we've got one that's a supplement. But by then you're at five, and you, and that just, perhaps we add, some ginkgo to the mix or something, and that also just keeps on adding to how things are processed, side effects and interactions. So it's not hard to get there. And like I said, a couple of them aren't even prescription or they're supplements, and they each seem reasonable on their own, but it's the total number that starts to matter, especially in dementia. And that's because specifically in dementia, the brain and the body are more sensitive to the effects of the medication. So we can sort of talk about this in terms of, people in general, but there's also some considerations when we think about people who have a dementia diagnosis. The other thing too is it's very common to have multiple doctors. So someone might have probably has a primary care doctor. Maybe they have a neurologist. They might have a cardiologist or a urologist, and everyone's trying to help, and everyone's really trying to take care of their problem that they're focused on. But they may not always see the full picture. So when the neurologist is starting a medication, they want to really help the problem that's in front of them, and they may or may not take a look at everything else everyone else is prescribing and how those interact. And then there's something called the prescribing cascade, which is when one medication causes a side effect and maybe we don't realize it's from the medication. And so instead of removing it, another medication is added to treat that side effect. So one sort of fairly classic example is that there are certain medications that help the bladder, but they can actually cause confusion. So if someone's taking that medication and maybe they've been on it for a while, but then they start to become more confused and it's unclear that it's necessarily from this medication, they may be prescribed another medication specifically for confusion or for the behaviors that are starting to show up. And so now we have two medications when really the first one caused the second problem. And these are very common, and it can be very difficult to figure out what's from a medication, what's from a new symptom. So certainly I think, you know, everyone involved in the care is really doing their best, but some of these things just may not have been thought about in that moment. And so it's usually polypharmacy isn't usually caused by one big decision, right? It's not usually someone like, here, have 10 pills. It's going to be a series of small, well-intentioned decisions that add up over time. So in the next few slides, I'm going to talk about the risks of polypharmacy. And this slide is going to give you an overview of some of the main risks that we think about with polypharmacy. And then I'm going to go into each one of these in a little more detail. So this is just the big picture. So as the number of medications increases, so does the risk of them interacting with each other. So does the chance of experienced side effects. We can actually see changes in thinking or alertness or behavior, and that has more to do with how these medications affect people who have dementia. It also creates a higher risk of falls, and that's really important because, as we know, falls can lead to hospitalizations and faster decline. And so again, I'm going to walk through each of these one by one in the next slides, but this gives us a sense of why we pay attention to that total number. And like I said, especially when we're thinking about somebody who has some cognitive impairment. So I'm going to start with side effects. So when someone has dementia and is taking several medications, the chance of side effects goes up because you could imagine While each medication may be helpful on its own, each one has the potential for side effects. And as we add them, the body has to work harder to process them. So even a small dose of a new medication can tip the balance. And maybe that dose by itself wouldn't have caused the side effect, but now that we're adding it on, it may be more likely to. So side effects can show up like dizziness, sleeplessness, stomach issues, suddenly seeming more confused or agitated. Someone might look weaker or walk differently or have trouble staying awake. And families might think that the dementia is getting worse. And I'm not saying that that's not the case, but it can also have to do with medications. So when we talk about polypharmacy, really it means that the more medications someone takes, the greater the chance of having side effects or adding new ones on top of those that someone already has. So even if it's all helpful separately, together, sometimes it can cause some problems. And so the goal is really to find the right balance. We want enough medication to help, but not so much that it starts to cause new or worsen side effects. So next, we're going to talk about worsening confusion or sudden mental changes. So when someone is living with dementia, their brain is already working harder to stay oriented and process information. And so sometimes when we layer on multiple medications, particularly the ones that act on the brain or nervous system, it can overwhelm those pathways that are already stressed out. They're stressed out just because they're working harder. So it isn't just about side effects like dizziness or nausea, but the brain may be struggling to keep up. And that can show up as sudden confusion. Suddenly they're having trouble following conversations. They might be more agitated or more sleepy or withdrawn. And this is where families might think things have progressed overnight. But it might actually be the cumulative medication burden is sort of tipping the brain over its threshold for how it can process things. So when we see sudden changes in thinking or behavior, it's always good to pause and look at medications, especially any recent additions or dose increases. And again, the goal shouldn't be to avoid treatment. It's just to use the fewest medications needed so we support the thinking and the comfort and the quality of life. Let's talk a little bit also about behavior changes. So, as we touched on earlier, some of the physical side effects like stomach upset or constipation, those can show up as behavior changes in dementia. When someone can't tell us that they're uncomfortable, we may see pacing or sudden irritability. In addition, the medications themselves can affect behavior. So, we talked a little bit about the stress on the brain, but when someone is taking multiple medications, especially those acting on the brain, that can, like we just said, lead to more agitation or more restlessness or more irritability. So we might see more changes in the behavior. On the other hand, you might see someone who gets quieter or withdrawn or less engaged. Now, if you have somebody who's been somewhat um, agitated or restless and they're quieter, that may actually be what you want the medication to do to help calm somebody down. But if it's a change and it's different than you were expecting, then it's time to think about that. And again, you want to think about this if there's a behavior shift after medication is started or changed, just to consider all the possibilities. Is there discomfort they can't express? Are the medications affecting how the brain regulates emotions? Sometimes just adjusting the medication plan, whether it's a dose or the time of day, can bring someone closer to their usual baseline. So I also want to talk about the risk of falls because taking multiple medications increases the risk of falls. Um, we've talked about some of the things about how it affects how the brain processes. And in addition, many medications, especially like sedatives or sleep aids, pain medications, even blood pressure medications and medications that affect the brain and can can, cause dizziness or low blood pressure, or the muscles to weaken, or a slowed reaction time. So as those build up, if someone's on something that's, a little bit of a sedative, and maybe they're also on something that lowers their blood pressure, it could add up to the body just having a harder time maintaining balance and staying steady. And then that puts them at higher risk of falls. And falls really are one of the most serious risks of polypharmacy, because we know that falls can lead to injuries, they can lead to fractures, to head injuries, or hospitalizations. And hospitalization stays can be very difficult for anybody, but especially for people with dementia. That confusion increases, and it can sometimes cause a bit more decline. So as part of managing medications in dementia, we have to think about whether a medication helps, but also whether the combination increases the fall risk. So our goal is always to keep people safe at home and avoid a preventable hospital visit. So I'll actually provide an example. I, on our urgent care platform, saw someone who fell. And when I took a look at the medications, I noticed that they were on something to help them with sleep, which typically isn't particularly risky, but they were also on melatonin. And again, melatonin, over the counter, it's a supplement. A lot of people take it. We don't think much about it. Those two together can cause more sedation. So this was a fall that happened at night when someone got up out of bed. And so those two together, it's possible that those added to the risks of the fall. A little more sedated, a little less steady on the feet. And then there were also some blood pressure medications. And so, the recommendation was check the blood pressure. Are we seeing a drop in blood pressure, as they're getting up? And could that be causing some dizziness and causing some falls? And so this was just some recommendations that I suggested be looked at, just because that's what I saw on the medication list. And finally, when someone's taking multiple medications, they don't just act on the body one by one, but they can interact with each other. So again, like I've said this before, but the brain and the body are more sensitive, so the interactions can have a bigger impact. Some medications amplify each other. I just mentioned that example of sleep medication. So maybe by itself, the sleep medication is not an issue. Maybe melatonin by itself is not an issue, but together, that extra drowsiness, slower reactions, and then you have a higher risk of fall. And then there are other medications that work against each other. So I mentioned this other, I mentioned this before, but some bladder medications have certain effects that can sort of cancel out some of the other medications. So if you're taking it along with a memory medication like donepezil, the bladder drug might block the benefit of that memory drug. So the person isn't getting as much of the memory drug, and then they might seem more confused. So when we talk about drug interactions in polypharmacy, we're really talking about how medicines can either compound each other's effect or cancel them out. And that's why it's important that every provider knows the full medication list, including the over-the-counter items and the supplements. So part of managing medications in dementia is thinking not only about whether a medication helps, but how it works in combination. Is it going to increase side effects? Could it potentially affect behavior or how they're thinking, or increase the fall risk? So that's really where we focus on this. Amy, I saw your hand shoot up, so I wasn't sure if there was something we needed to stop for.
No, I don't know why I did that,
Okay.
but we do have to talk about it. Well, I could ask right now because it was about this. He's wondering just what exactly about donepezil decreases when you're on that bladder medication you mentioned. Or
so it sort of depend on which medications you're on, but the way that the bladder medications work is it's what's called an anticholinergic effect. And what that's doing is it's actually blocking the cholinesterase, which is what we need more of with dementia. So donepezil is trying to make more cholinesterase, and then the bladder medication is blocking it. And it's blocking it so that it can have the desired effect on the bladder, which is, usually it's decreased frequency of urination. But in the brain, the medication isn't going to say, like, oh, I'm only going to do this in the bladder. It's going to do it everywhere in the body. So it blocks it in the bladder. That's great. Blocks it at the neurotransmitter, and then that can decrease the effect of the donepezil. And so it's not as simple as saying, like, oh, you can't take the two together. It really, you have to look at everything. You have to look at, dosing and, can you maximize the dosing and how, or how you take it or when you take it. So it's pretty complex, but that's in general what's happening. One's blocking and one's trying to make more of it. So that actually gets us into sort of like reviewing medications and tools. So when I do a medication review, the first thing I want to know is, what's the question? What's the concern? Is it, can you just review these medications and tell us what you think? Is it specific concerns like new confusion or sleep changes or increased urination or something like that? And someone's asking, could it be related to a medication? So the first thing I'm going to do after I gather the list of medication, including prescriptions and over-the-counter medications and supplements, because they all count, is the first thing I'm going to do is look for interaction. Any medications that could be amplifying each other or working against each other. Another example, actually with donepezil, these are actually things that this is an amplification, but there are certain cardiac medications, sometimes used for blood pressure, sometimes used for other things, called beta blockers, and they can slow the heart rate, and so can donepezil. So together, they can cause the heart rate to be even slower. And it may not matter. It may be fine. It may, maybe somebody's on both of these and their heart rate is completely, it's lower, but it's normal. But if it's going quite low, it can make them dizzy, and that can lead to falls. And then I'm also going to look to see if there's any that, might, work against each other or are very serious interactions. There are some medications that the recommendation would be to not have them together. But there still might be reasons why they are, but we just have to think about that as well. Then there's a couple of safety profiles that I look at, and these are pretty well known and well studied. And one of them is called the Beers criteria. And it's a guide that we physicians use to understand medications that might be higher risk for older adults. It's not a list of like, never use these. It's just a tool that helps us weigh the risks and benefits thoughtfully. So one example that sometimes comes up is around blood thinners. So that might be risky for somebody who is a high fall risk, someone who is very unsteady, because they might fall and injure themselves and have more bleeding than we would, want them to have, especially if they hit their head. But it's also essential to, prevent a blood clot or, prevent a stroke in somebody who has AFib. And so you have to balance the benefit with the risk. And so someone at a certain point, it might make sense that the benefit might outweigh any risk. And sometimes that can shift. Sometimes someone who is on a blood thinner becomes somebody who is at a high risk for falls, and then we may have to reconsider it. And then there's some other safety tools that I use. That stop-start criteria also helps to identify medications that might no longer be useful or helpful, and START helps to remind us of medications that could be missing. Because there's times when not prescribing a medication can also lead to harm. And once I put all of these things together, I'm going to think about the clinical question, and sometimes the answer is very simple. For example, we had someone who was getting up at night to use the bathroom, and we noticed that they were on a medication that caused urination. They were taking it at night, and if we moved it to the day, it would probably change things. So it could be as easy as that. And sometimes it's a little bit more complex, right? Maybe it is about donepezil and some other medication, and you really have to look at the whole thing together and decide what makes sense. The other thing we sometimes see is medications that are truly very risky for people, for older adults, especially those with dementia. Some of those are the benzodiazepines, and those can be used for agitation or anxiety, and they can certainly be helpful, but have a lot of risk associated with them, and there might be safer first line options. So that's another thing to consider. So what I want to think about is making sure that medications are working for someone, not against them. So I will typically review and make some recommendations. And I'll review them with the care navigator, and the care navigator can discuss them with the family, or I'll discuss them with the family. And then we share them with the primary care physician to review, because it's really up to them to make any changes. And this is how I do this, but you can ask the pharmacist to review medications. You could ask the primary care doctor to review medications. Once I give my recommendations, the primary care doctor may feel that the changes make sense, or they might feel that everything should be kept the way it is. And either outcome is completely fine. Like I said, the goal is not necessarily to stop medications automatically. It's to make sure that each one continues to support everyone's safety, their comfort, and their quality of life. All these medications have a purpose, and so there may be reasons why they need to be given together, and that's okay. So sometimes after reviewing medications, a physician may find that some medications are no longer helping or might be contributing to side effects or confusion. And when that happens, the next step is something that we call deprescribing. And deprescribing simply means carefully and gradually reducing or stopping medications that may not be needed anymore. And it's always done in a planned and supervised way. The goal isn't to stop medications for the sake of stopping them. It's to make sure that each medication still supports the care goals. And sometimes when doctors have these discussions, families can feel surprised or can feel like a little unsettling, especially if it's a medication that has been part of your loved one's routine for many years. And it's normal to sort of wonder, well, why change something that seems to help? Or what if things get worse? And I think that those are reasonable questions to ask if someone's talking to you about this. And we never want to take anything away suddenly. So you want to make thoughtful adjustments, safe adjustments. Can you start with decreasing a dose if somebody thinks it's time to come off of a medication? Because this really should be a team effort. Like I said, it could start with a pharmacist, a specialist, a primary care physician, and just noticing something could be simplified. Like, I wasn't that person's doctor when I saw them for a fall, but I saw something that I thought could be helpful. And I wanted to let the primary care doctor know my thoughts in case that was helpful to them. And so, and the care team should be reviewing the recommendations and reviewing it with the family and sort of coming to these decisions together and doing it safely. And just an important reminder, you don't ever want to stop these on your own, and you don't want to stop anything suddenly. And so, sometimes someone will start a medication and they'll feel like there's a side effect. And I think that even still, calling the doctor who prescribed it, letting them know, if it's not safe to give it to them again, that's okay, but you do need to let the doctor know. And just remember that some medications do need to be reduced gradually. So definitely bring it up with the doctor if it seems like something's not working or you're concerned about that medication list. Which brings me to my next point of what can families do? So there's my keep one. Oh, that's not what I wanted to do. It's still, look at that, it's pulsing. So you want to keep one up-to-date medication list. That is probably the best thing that you can do. Either one person keeps it and make sure everyone has a list, but just keep it in one place. It should be clear and it should be updated. You should make sure you bring it to every appointment, not just the primary care doctor. The specialists need to see it. They need to see the whole picture. And don't forget to include those over-the-counters and those supplements. So either bring the list or you could bring the bottles to every visit. And definitely, if you're part of the GUIDE program, update your care navigator. And another thing too is sometimes there's so many bottles in the house, it can get confusing, especially if there's different doses or things like that. So if you're noticing that there's duplicates, or definitely bring your bottles to the doctor's office so that someone can go through the list and let you know, get rid of this. We don't want to keep old medication around because it could just end up confusing things. So you want to just make sure that when you have all the bottles together, it's everything they're taking. Not like, oh, they're taking this, but like 6 months ago they were taking that, because that just gets confusing. Let's get this to stop pulsing. So, and then what can you do if you're worried about medications? I mean, we've talked about, maybe the doctor sees something and does a review, but, you all are are caring for people. So trust your instincts. Like if you see some changes and you're concerned about them, bring them up. Explain the changes. Consider asking, could it be the medications? And you can always request a medication review. You could ask the care doctor to do it. There's a lovely pharmacist. You could ask a lovely pharmacist to do it. If you're in the guide program with us, your care navigator can help pull everything together, flag the concerns, and then the clinical team will perform a medication review with those recommendations. All right, so I left some time for questions and also a little reminder about to always come to our sharing cares and our next one. Let's see.